Police say the 40-year-old male patient attacked the 70-year-old female nurse Friday afternoon, allegedly beating her unconscious. The patient then locking himself in a bathroom and was held by security until NYPD arrived.
A study by HAL suggests that since 1995, there have been 256 sentinel events that involved assault, homicide, and rape within the confines of a hospital. In fact, it is estimated by Gatke Smith et al. That $4.7 billion have been paid out as a result of workplace violence. That figure accounts for 1.7 million non-fatal violent episodes and 900 homicides each year. If those numbers were not alarming enough, statistics collected by Speroni, Fitch, Dawson, Dugan, and Atherton show that 50% of all nurses have had some violent act committed against them, and over 70% have been verbally abused during their career. Studies show that many cases of violence often go unreported. What seems to be clear, however, is that nurses do not undergo enough training in regards to the management of potentially violent patients. However, identifying the patient population that can cause violent acts can be difficult. Most often, violent episodes are associated with mental health and substance abusers. Violent acts can occur on any unit in the hospital at any time. The study by Liu et al. Does seem to indicate that 1 to 8% of all ED visits, however, are by patients with substance abuse problems or a mental health history. A fact sheet entitled "Increased Emergency Room Use by People with Mental Illnesses Contributes to Crowding and Delays" indicates that 1 out of every 8 emergency room visits are mental health related. In fact, it is estimated 12 million emergency room visits per year are either mental health patients or polysubstance abusers. With violence being so prevalent in hospitals and against nurses, can the use of a preventive assessment tool help lower the incident rate of violence against the nurses in a hospital setting? An algorithm, much like the one shown now, can be helpful in guiding a nurse's decision-making process. Chapman in his study found 9 distinct components of predicting violence and placed them into a stamped DAR assessment. The PPEAT assessment, which was specifically designed for emergency mental health nurses, is an assessment designed to objectively assess what the nurse sees and hears. Both assessments aid the nurse in assessing agitation and makes it possible to identify early signs of agitation. With the use of these assessment tools, and with early identification of episodes of agitation or violence, it is possible to decrease workplace violence against nurses. In addition to providing assessment tools, an algorithm can also help guide the nurse once a violent situation has occurred. It can provide for the use of emergency medications as well as indications for possible restraint use. However, restraints are generally located and ordered through specific hospital protocol. The goal of identifying violent situations early, according to Smith, Josh, Wes, and Pasick, is to ultimately avoid restraint use, as this can be dangerous for both the patient and the nurse. All of the studies discussed in this video are very clear on the problem. Violence against nurses is very real, and it happens daily. However, there are no studies that measured the success rate of assessment tools, and no studies that provided a very clear solution. It is clear, however, that studies should be conducted to measure outcomes of mental health assessment tools and their possible reduction of violence in specific units where violence is prevalent.